Pull your hands out, dude. Pull your hands out.
Police in Salt Lake City are coming under scrutiny after an officer shot a 13-year-old boy with autism spectrum disorder after he did not comply with demands to get on the ground.
This project is titled Bridging Care in Crisis and focuses on developing a virtual reality-based de-escalation training program in partnership with the Southern Methodist University, the Dallas Police Department, and community organizations. At its core, this project asks a critical question. How can we ensure that interactions between law enforcement and individuals with autism are safe, informed, and compassionate? Now let's go back to the video we watched at the beginning. To understand why this work matters, we begin with a real-world case. In this situation, there was significant miscommunication between law enforcement, a young boy with autism, Lyndon, and his caregiver, Golda, his mother. While officers were aware of his diagnosis of autism, they were not adequately trained to respond to the autism-specific behaviors. As a result, officers relied on general law enforcement tactics rather than de-escalation strategies tailored to neurodivergent individuals. This created a major communication gap. Behaviors associated with autism were misinterpreted as non-compliant or aggressive, which escalated the situation unnecessarily. This was not a failure of character, it was a failure of systems. From this, we need to take away two lessons. Officers need a strong understanding of autism, and they must actively communicate with caregivers during crisis situations. What is autism? Autism spectrum disorder is a neurodevelopmental condition that affects how individuals interact, communicate, and behave. These areas, interaction, communication, and behavior, are especially important in police encounters. Individuals with autism may be verbal or nonverbal, avoid eye contact, take longer to process instructions. These behaviors are not defiant. They reflect differences in how individuals process information and respond to stress. Our goal is to design and implement immersive training that improves law enforcement preparedness in crisis situations involving individuals with autism. A key part of this approach is recognizing the role of caregivers. Caregivers are not bystanders. They are essential partners who understand the individual's triggers, communication styles, and calming strategies. Their presence can be the difference between escalation and resolution. Law enforcement officers are required to make split-second decisions in high-stress environments. Without the proper tools or training to recognize autism-related behaviors, even well-intentioned responses can lead to harmful outcomes. This case serves as a reminder that autism-informed training is not optional, it is essential.
Reality of police interactions. The problem. 1 in 5 autistic young adults interact with police. This is not a lack of effort, but a lack of standardized evidence-based training. This is not an issue of effort, like I said. Both police officers and caregivers are willing and want to collaborate with the autistic community. The gap lies in the lack of standardized evidence-based training, needing consistent response strategies that equips officers to confidently and appropriately navigate these interactions across all levels of the spectrum. What goes wrong? Breaking down the typical interaction between a police officer and an autistic individual, what often goes wrong is that the autistic individuals stem from a lack of exposure to officers and that officers have to the autistic individual. In these types of situations, especially when caregivers are involved, it can lead to a misunderstanding of the confusion and feelings of unsafety that autistic individuals may experience in response to loud, stern commands and close physical proximity, as well as their need for personal space. Our mission statement has to do with the 12-month pilot program. In this program, police officers will have exposure to autistic individuals through VR scenarios and simulation-based scenarios in person.
Based on our mission, our project proposal is to work with the Dallas Police Department and the community to help facilitate collaboration in creating community-informed, evidence-based training. Through collaboration and improved training, we know that this will have an impact beyond the 12-month pilot program, creating the sustainability and impact we want. This project would not be possible without collaboration with organizations within the community, including Apara Autism Center and HHM Health. SMU would serve as the bridge connecting these groups with the Dallas Police Department to strengthen and build on existing autism training. So let's talk about how we would improve DPD training. We began by meeting with the crisis intervention team at the Dallas Police Department to identify training gaps, and we found 3 key areas for improvement. First, strengthening autism training modules by emphasizing communication assessment, so assessing whether the individual is verbal or nonverbal, and using clear, simple, direct language in order to help de-escalate these situations. Second, creating 2 to 3 additional VR scenarios since DPD currently only has 1 and requested more. Third, developing a quick reference handout with key strategies officers can use in the field. We have already begun implementing these strategies, including working with the community to develop new VR scenarios, which you can see on the screen. You can pause the video here to view the new scenarios more in-depthly. So when it comes to sustainability, this project is designed for long-term impact. By maintaining strong partnerships and continuously developing new scenarios, we can build a growing library of training resources for the DPD. And these relationships ensure that the program remains adaptable, relevant, and sustainable beyond the initial 12-month pilot phase. When it comes to our budget, the pilot program is designed to remain low cost with an estimated budget of under $3,000. By leveraging existing resources and partnerships, the program is both feasible and scalable.